네, 여러분 다시 한번 협조의 말씀드리겠습니다. 잠시 후 장내로 장관님과 내빈 여러분 입장하시면 저희 개막식 시작하겠습니다. 자, 여러분 저희 정시에 시작할 수 있도록 이제 모두 자리에 앉아주시고 지금부터는 자리를 지켜주시면 고맙겠습니다. Ladies and gentlemen, once our distinguished guests enter the hall, we will begin this opening ceremony momentarily. So ladies and gentlemen, we ask for your cooperation once again. Please now be seated. Thank you. 소지하고 계신 전자기기도 한 번 더 확인해 주시고 지금 자리에 리시버 준비가 되어 있습니다. 오늘 한국어는 채널 1번입니다. 필요하신 분들은 이어폰을 꽂아주시고 전원을 켜신 후에 채널 1번으로 설정해서 청취해 주시면 되겠습니다. For your information, once again, we do provide simultaneous interpretation from Korean to English and vice versa. Please use the receivers on in your tables. Channel 2 is for English. Please plug the earphone first and then turn on the device and you can set to channel 2 for English translation version. Thank you very much for your cooperation. So ladies and gentlemen, for those of you who are in the foyer, please enter the hall and take your seats. And once again, we'd like to begin this opening ceremony momentarily here in this room. Thank you. 네, 여러분 다시 한번 안내드리겠습니다. 저희 곧 개막 행사 시작을 하겠습니다.
May I have your attention, please? We will soon begin the opening ceremony. Please take your seats.
Begin the opening ceremony of the Medical Korea 2026. So now please take your seats. Thank you. 저희 곧 시작하겠습니다. 모두 자리를 지키고 잠시만 기다려 주십시오. 네, 여러분 저희 잠시 후 이 자리에서 개막 행사 시작하겠습니다.
We're going to start the opening ceremony in a minute. We're going to start in a minute. I'd like to ask you to check your mobile phone.
Soon begin the opening session here in this room. If you have any electronic devices, please set them to silent mode. We'll soon begin. Thank you very much for your patience. 네, 여러분
We'd like to start right now. Good morning. This is guests for Medical Korea 2026. Everybody who's come here for the opening ceremony of the event. I am the host of this event. I am Lee Seung-hee. Nice to meet you all today. Thank you.
good morning and welcome to the opening ceremony of the Medical Korea 2026. My name is Jessica Lee and today I'll be your MC at this very meaningful session. Thank you once again for your participation. 오늘 정말 국내외에서 많은 분
We have a lot of participants from home and abroad. We are providing you a simultaneous interpretation service. We provide two languages, Korean and English. If you need the service, channel 1 is for Korean to listen to the interpretation.
Further, please take a look at the screen. We do provide simultaneous interpretation from Korean to English and vice versa. So please use your receivers and set to channel 2 for English. Thank you. 네, 이렇게 많은 분들께서
We are having a lot of audience from on and offline channels. I'd like to welcome all of you, Medical Korea 2026. It is an event organized to enhance the international recognition of Korean healthcare, foster industrial synergy, and strengthen competitiveness through the exchange of global medical trends and expansion of global networks. It's an international gathering in the global healthcare sector. And starting with opening ceremony, we'll have forums, business meetings, exhibition hall, and G2G events. We have a diverse range of programs ready for you. Till the very end, I do hope that you could take a full interest and participate till the very end. And I'd like to introduce to you distinguished guests from home and abroad. As I call out their name, please give them a big round of applause. First of all, we have Honorable Kim Yoon, member of the Health and Welfare Committee of the National Assembly from the Democratic Party of Korea. Kim is underway to come here, and we'll welcome it later. We have Honorable Lee Joo-young, member of the Health and Welfare Committee of the National Assembly from the Reform Party. She's with us today. Thank you. We have Her Excellency Jung Eun-kyung, Minister of Health and Welfare, who has come here out of their very, very busy schedule here with us. Welcome. Thank you. We have Mr. Cha Sun-do, President of the Korea Health Industry Development Institute, here with us. Please give me a big round of applause. And also we have guests from abroad. We have His Excellency Jin Bureng, Jikje-dae-sureng, Minister of Health and Mongolia, is with us today. Also, we have Honorable Yevgeny Gonchar, Deputy Minister of Health of Ukraine, here with us. We also have Dr. Eduardo P. Banzon, Director of the Human and Societal Development Sector Office at the Asian Development Bank, ADB, here with us. We also have lots of dignitaries from the embassies. We have Alex Madovov. We have His Excellency Ambassador of the Uzbekistan. We have Alvarez. We have His Excellency Mugure Aguiles, Ambassador of the Embassy of Paraguay. Thank you. We have Kim Hyung-tae, Chairman of the Korea International Medical Association and President and CEO of Seoul National University Hospital, here with us. Please welcome him with a big round of applause. We have lots of audience coming here on the way, and as they arrive, I will call up their name so that they can be well welcomed here. Once again, I'd like to extend my warm welcome to all you, and please understand that I cannot call out everybody's name. Medical Korea held a contest through the International Medical Advising Festival, inviting submissions from domestic international medical institutions, related organizations, and creators under the themes of care, innovation, and connect. And among the entries, we have the grand prize awarded by the President of Korea Health Industry Development Institute, and we have all the winners here. We will take a video. Medical Beyond Borders by Doda Media, which jointly won the grand prize.
I thought it was finally over. I'm still alive. When the dark went away, people were looking at me. Some of them smiled. I think maybe I still have a chance. I saw a child passing by. I don't want to go to the hospital anymore either. My head always hurts. Dad is always sad. The only thing in this world I can never have is a quiet mind. I'm getting sleepy now. I hope God grants me tomorrow. I got a chance too.
네, 여러분 응원의 박수.
Please give a big round of applause for this content. How did you like this video? This is an excellent content reflecting the trust, innovation, and the connecting value of healthcare. With this video content, we have opened the Medical Korea 2026. We would now like to invite our distinguished guest for remarks. First of all, let me invite Mr. Cha Sun-do, the President of Korea Health Industry Development Institute, for the opening remarks. Please welcome him with a big hand. Good morning, distinguished guests. I am Cha Sun-do, the President of the Korea Health Industry Development Institute. Let me extend my sincere gratitude to all distinguished guests for being here with us for Medical Korea 2026. Kim Yoon, the member of Health and Welfare Committee of the National Assembly, is on his way here, and I would like to thank Her Excellency Eun Kyung-jong, the Minister of Health and Welfare. I would like to also thank His Excellency Chimbureng Jigjidu-sureng, the Minister of Health from Mongolia, His Excellency Evgeny Gontar, the Deputy Minister of Health from Ukraine, Your Excellency Tara Rusander, the Deputy Minister of Economy from the state of Utah, U.S., and I would like to thank distinguished ambassadors to Korea for being here with us. I would also like to thank the recipients of the commendations for their contribution to the development of Korea healthcare, as well as distinguished guests from home and abroad for their presence here. Now, healthcare has become a key industry that creates jobs, generates substantial value, and will shape the future of the nation. And this transformation is clearly reflected in numbers. The global healthcare services market is valued at about $10.7 trillion and is growing every year by an average of 5.2%. The medical tourism market, the one that we need to pay attention to, is expanding at a remarkable annual average rate of 21.6%, reaching a market size of $35.8 billion. Korea is at the forefront of this transformation. In 2024, spending by international patients visiting Korea generated a total production inducing effect of 13.85 trillion Korean won in the domestic economy. They spent about 7.5 trillion Korean won. The influence of K-healthcare has now become a powerful pillar supporting Korea's service industry following K-pop and K-content. As such, the rapid rise in the global status of K-healthcare, as reflected in the theme of Medical Korea 2026, strategic collaboration is no longer an option. It is essential to accelerate the future of AI-driven healthcare, and strategic cooperation is essential. All stakeholders in public and private sectors need to come together, and then we will be able to overcome the barriers in the global market. This is why in Medical Korea, we prepared Business Roundtable where governments and companies from Korea and abroad come together, as well as Global Medical Partner Pavilion, which brings together overseas healthcare institutions and related industries. These are the new platforms we adopted this year. And a business matchmaking session will be held with the participation of 38 buyers from 19 countries, including the US, Singapore, China, and Japan. And we will sign a patient referral agreement with the government of Mongolia. For Korea to become a global leader in healthcare, the efforts of those on the front lines The medical institutions and professionals across the global healthcare industry are very important. Those of you here today are not simply healthcare providers or administrators. You are the champions of export and pioneers shaping a healthier future for humanity. I encourage you to take pride in your work and confidently showcase Korean healthcare to the world. Thank you for your attention. Thank you very much for your remarks. K-medicine has grown in the world, and he emphasized the importance of global healthcare cooperation. Please give him a big hand.
Thank you. We open the ceremony with opening remarks. Now we'll listen to welcome remarks. We have welcome address from Her Excellency Minister Chung Eun-kyung of the Ministry of Health and Welfare. Please give Minister Chung a warm round of applause. Good morning. I am Chung Eun-kyung, Minister of Health and Welfare of the Republic of Korea. It's my pleasure to warmly welcome all the distinguished guests from Korea and abroad who have joined us today for the opening ceremony of Medical Korea 2026, a premier global event in the field of healthcare. I'd like to extend my sincere appreciation to His Excellency Chimburen Jikjit Sureng, Minister of Health in Mongolia, and His Excellency Evgeny Gonchar, Deputy Minister of Health in Ukraine, for traveling a long distance to be here with us today. My heartfelt thanks go to National Assembly members Kim Yoon and Lee Joo-young, who have graciously taken time out of their busy schedules. I'd like to express my gratitude to ambassadors to Korea, as well as to Mr. Kim Young-tae, President of the International Healthcare Association of Korea, and all the other distinguished guests for joining us on this meaningful occasion. In addition, I'm pleased to welcome our keynote speaker, Mr. Edward Marks, CEO of Marks Advisory, who's come long distance to come to deliver a keynote speech. We look forward to your insightful presentation. I'd like to convey my deep appreciation to President Cha Sun-do of Korea Health Industry Development Institute and all those who have worked tirelessly to organize this event. Now, in its 16th year since its inception in 2010, Medical Korea 2026 will be held over the days under the theme AI-powered global healthcare, bringing the future and the world closer. With the advent of generative AI, technological advancements are progressing at an unprecedented pace, leading us toward a future that is fundamentally different from anything we have experienced before. It remains difficult to predict exactly where these changes will lead. However, one thing is certain. In the field of healthcare where human lives are at stake, AI must be harnessed to ensure that no one is left behind and that everyone can receive timely and appropriate medical care. To this end, the Korean government, as a global leader in healthcare and AI, is advancing the realization of AI-driven essential healthcare. We are transforming hospital information systems in public and national hospitals into cloud-based platforms and expanding access to GPUs essential for AI utilization. Through these efforts, we aim to build a public healthcare AI highway, enabling seamless data exchange and integrated AI use across public healthcare institutions. Furthermore, we are establishing a national integrated bio-big data platform based on clinical and genomic data from approximately 1 million individuals. We will expand medical data programs. We are developing AI technology to optimize emergency patient transport and referrals and plan to introduce AI-powered teleconsultation models, particularly in medically underserved regions facing workforce shortages. Through these initiatives, we will deliver universal healthcare services regardless of region, income, or age, while simultaneously enhancing innovation and efficiency across the healthcare sector. Distinguished guests of home and abroad, Korea is at the forefront of the global healthcare industry, supported by world-class medical infrastructure and advanced technologies. In 2024 and 2025, the number of international patients visiting Korea reached 1.16 million. It will reach that number. The Foreign Patient Attraction Program first began in 2009, and it is a 20-fold increase compared to those numbers in 2009. This remarkable growth is a testament to the global trust in the excellence of Korean healthcare, and it firmly established Korea as a leading hub of healthcare. Korean healthcare has also expanded globally with 122 projects across 21 countries and contributes to enhancement of local healthcare services. Building on this global presence, we plan to develop new export models in digital healthcare, supporting clinical trials and real-world validation of Korean medical devices by leveraging the advanced infrastructure of Korean hospitals overseas. And also, along with the paradigm shift for foreign patients, we're establishing programs for non-face-to-face consultation, covering all the way to fellow programs to have integrated platform so that the foreign patients coming to Korea could enjoy all these healthcare benefits by having high quality and high quantity services for them all. We're also continuing to strengthen international cooperation. The United Arab Emirates has elevated Korea to a Tier 1 country, recognizing the license of Korean medical doctors and traditional Korean medicine practitioners. And as of this year, Korea has also been designated as a reference country, which is expected to facilitate expedited approval processes for medical products authorized in Korea. On the occasion of this conference, Medical Korea, we plan to sign agreement with Mongolian Minister of Health on cooperation in government-sponsored patient programs and medical training. And we also exchange discussions with the Deputy Minister of Health of Ukraine on collaboration in healthcare and also post-war reconstruction. I sincerely hope that Medical Korea 2026 will serve as a meaningful starting point for strengthening cooperation among countries, healthcare companies, and medical institutions, and also as a platform for collectively exploring the future of global healthcare driven by AI. Once again, I warmly welcome all of you to this event with all my heart. Thank you. Please give Minister Chung a big round of applause. Thank you so much for your wonderful words. Thank you so much for coming all the way here to talk about the meaning of this event. And the healthcare industry of Korea hopefully could grow further with the world and introduce the efforts of the Korean government as well. Thank you so much.
Now, we would like to listen to congratulatory remarks from distinguished guests. The congratulatory remarks this time will be conducted in English. Please wear the translation receiver. First of all, we have the Minister of Health from Mongolia, His Excellency Chimburen Dikchidesreng, will give us the congratulatory remarks. Please welcome me with a big hand.
Applause.
Her Excellency Mr. Jung Yong Kyung, Your Excellency Lee Jeong, the Member of National Assembly, Excellencies, distinguished guests, ladies and gentlemen. It's a great honor for me to extend my sincere congratulations on the opening of Medical Korea 2026. In commend the government of the Republic of Korea and the organizing committee for convening the prestigious global platform, Medical Korea has become not only a showcase of medical excellence, but a driving force for innovation, connectivity, and leadership in global healthcare. Mongolia places the highest priority on international collaboration in health. In this journey, the Republic of Korea stands as one of our most trusted and strategic partners. Our cooperation spanning medical education, advanced treatment, technology transfer, and human resources development has delivered tangible impact. A notable example is the recent introduction of a Korean-made robotic surgical system in Mongolia. These milestones represent not only technological advancement, but a new chapter in delivering precise, safe, and high-quality care of our patients. It's a clear reflection of how our partnership is transforming innovation into real outcomes for people. Today, as we face increasingly complex global health challenges, one message is clear. No country can advance alone. Progress in health must be built on partnership. We must continue to accelerate innovation, share knowledge without borders, and ensure that quality of healthcare is not a privilege, but a universal right. Medical Korea provides exactly this platform where ideas meet action and partnership shape the future. I'm confident that Medical Korea 2026 will further deepen our cooperation and inspire new solutions for healthier, more resilient world. Let us move forward together toward a future where innovation saves lives and collaboration defines progress. Once again, I extend my warmest congratulations and wish this important event every success. Thank you very much.
Thank you very much, Minister Jigjistreng, for gracing us with your participation and of course with your meaningful words. Thank you. 고맙습니다. 자, 이어서는 우크라이나 최고 라다 의장 요비치.
Now we would like to invite the government official from Ukraine through video. Honorable colleagues and partners in the Republic of Korea, congratulations for the opening of Medical Korea 2026. And as the world is now faced with new challenges in the healthcare sector, it is more important to utilize innovation, digital solution, and artificial intelligence in the medical sector. This is why the theme of the conference this year is truly timely and strategically important. For Ukraine, Medical Korea 2026 provides a precious opportunity to learn about best practices from around the world, engage in professional dialogue, develop our partnerships in medical technologies, reform health systems, and rebuild our medical infrastructure. We deeply appreciate and value our friendship with the Republic of Korea. Korean companies are well known for their abundant expertise and experience. We hope that they will actively join us in our efforts to rebuild our country with large-scale infrastructure projects. I wish all of you fruitful outcomes and constructive discussion, as well as new solutions to ensure a healthier future. Thank you very much. Please give him a big hand. Thank you very much for sending us this congratulative remarks through video.
We listen to congratulatory speeches. We have Representative Kim Yoon of Democratic Party of Korea, a member of the Health and Welfare Committee. Please welcome the speaker with a big round of applause. Good morning. I am Kim Yoon. I am a member of Democratic Party and also Health and Welfare Committee. I'd like to congratulate the 16th opening of Medical Korea 2026 with all my heart. I'd like to thank Katie and Ministry of Health and Welfare and all the people involved in these entities. And also I'd like to thank all the people from home and abroad. The world is now witnessing a big change to be brought by AI, and healthcare is no exception. AI is helping us with not only diagnosis but operations and new drug development. In the entire scope of healthcare, AI is playing very big roles. Many people talk about technological advancement and development. However, in order for it to be done well, and also in order for that to give us big benefits, I think what's most important is how we utilize the data in the development of AI technology itself. Korea has a very high level of healthcare digitalization and informatization, having huge amount of data in healthcare institutions, and also you have a universal healthcare coverage in the medical insurance, having a huge amount of data for all patients. AI can be utilized, but there are many hurdles here for them to be utilized using technologies. To address these hurdles, we need to come up with solutions for information usage, and also we need to have legislative ledgers to safely utilize these data sets. Even when technologies are developed, we need to think about how well or how safe to use them. Without it, it doesn't mean much. And also have social scheme of universal medical insurance. So how the technologies must be incorporated into the insurance so that it can be used more universally and safely for all the patients, so that they don't have to pay too much money and still utilize these benefits. AI is giving many added values to the existing technologies, and that's not enough. If we think that that's the only thing, that the effects of AI cannot be in full spirit. We also need to have full organic alignment between AI and healthcare to bring about high productivity and cost reduction. These must be ultimate goals we need to keep in mind. Medical level of Korea is very high, and also we have high level of AI technology. All the technologies developed in Korea are hopefully contributing to serve as benchmark roles for people of the world to increase their quality of life in healthcare. And this is what we are hoping for. Hopefully, based on the cooperation we have with all the people here, Korea could even advance further with AI as a leverage. And hopefully, we could contribute to enhancing the health conditions of people of the world. Thank you. Thank you so much for the wonderful remarks. Thank you so much for coming despite busy schedule. Representative Kim Yoon for coming all the way here.
Next, we would like to invite Chu Young Lee, the member of Health and Welfare Committee from Reform Party of Korea. Please welcome her with a big hand.
네,
Good morning, distinguished guests. I am a member of Reform Party of Korea, and I am a member of Health and Welfare Committee at the National Assembly. Let me sincerely congratulate the opening of Medical Korea 2026. My sincere congratulations for the Ministry of Health and Welfare and the organizer of the event. The government and the National Assembly's role is to help each other in this time. And I visited Japan and Taiwan, and I saw how the technologies are being developed in AI, semiconductor, and in the areas that will bring about new jobs in the future. I talked with experts in those countries. We talk about AI, but the ultimate goal of AI is about how to make the lives of human beings more convenient, safer, and healthier. This is what I felt in my discussion with them. In the end, healthcare is very important, and the world needs to come together to find a solution. This is why at the Reform Party of Korea, we are making great efforts for the development of digital healthcare. And we have a long-term view on this, and we have been making preparations for digital healthcare development, because healthcare and medical services are not just about technologies. K-medicine is growing across the world. This is because we have technical capabilities as well as institutional foundations. This also means that we spread our culture and philosophy as well. This is why let me sincerely thank all of you here. I always say that people working in the front lines are working faster than policymakers, and they have great expertise. And our companies and researchers are working very hard. We at the National Assembly will do our best to help them make progress further. I hope that Medical Korea 2026 will usher in the era of true globalization in healthcare. Congratulations for all of you. Thank you very much. Thank you for your congratulatory remarks. So she has been making great effort for the healthcare.
him 축전
I'm going to introduce to you congratulatory remarks, congratulating on opening of Medical Korea. Hopefully, the AI and healthcare technologies are broadening the horizons of healthcare of Korea. Hopefully, Korea's competitiveness could further be enhanced. I'd like to extend my gratitude for sending us congratulatory remarks. I'm going to introduce to you Mr. Kim Young-tae, President of Korea International Medical Association and President of Seoul National University Hospital, for delivering congratulatory speech. Please welcome the speaker with a big round of applause. Good morning, distinguished guests. I am Kim Young-tae, President of Korea International Medical Association and President of Korea Seoul National University Hospital. First of all, I'd like to extend my sincere congratulations on the opening of Medical Korea 2026. I'd like to express my deep appreciation to Mr. Jung Eun-kyung of the Ministry of Health and Welfare and President of Korea Health Industry Development Institute for organizing this meaningful event. I'd like to welcome Representative Kim Yoon and Lee Ji-young for coming here despite your busy schedules. Also, I'd like to welcome distinguished guests who travel from far, Mr. Chimbreng Jigrasun from Mongolia. He's also a surgeon just like me. And also we have Vice Minister Yevgeny Kontar of Ukraine and Director Edgardo P. Banzon of the Asian Development Bank, as well as ambassadors to Korea and all the distinguished participants present at this opening ceremony. As we mark the 16th anniversary of Medical Korea 2026, I hope this event will serve as a valuable platform for sharing the latest trends among domestic and international experts in global healthcare, strengthening partnerships among nations, and advancing our shared goal of improving global health. Since its establishment in 2010, the Korea International Medical Association has played a leading role in promoting Korea's outstanding medical infrastructure to the world, advancing international healthcare cooperation in the private sector. As a representative organization in Korea, conveying the voices of the field to the government policy and contributed significantly to establishing Korean healthcare as a globally trusted field. As it was mentioned several times, this year's theme of Medical Korea is global healthcare, AI-powered global healthcare, being the future and the world closer. AI is no longer a supportive tool. It is refining the standards of the entire healthcare continuum from diagnosis and surgery to drug development. In particular, powered by world-class ICT capabilities and many sorts of medical data mentioned by Representative Kim. We have AI medicine, and the medical field is poised to become a global icon of innovation. Through this conference, I hope that Korea's advanced medical IT technologies and outstanding clinical expertise will come together to accelerate a future in which people around the world can access high-quality healthcare more easily and equitably without their economic status on equal footing. Once again, I'd like to congratulate the opening of Medical Korea 2026. And also, I'd like to extend my thanks to the Director Chung, and also sincere gratitude to all of those people for preparing for this event. Thank you so much for the wonderful words, Dr. Kim, as a last congratulatory speech.
헬스케어 유공보
Now we'll have a award ceremony. This is to facilitate the healthcare industry, to enhance the competitiveness of Korean healthcare industry, and awards and accommodation given to those individuals and institutions.
오늘
Let me make an announcement. Many people prepared a bouquet, but please refrain from delivering the bouquet to the awardees during the ceremony. But after the ceremony is over, we have 2 presidential commendations, 3 prime minister's commendations, and 7 Minister of Health and Welfare commendations. Let me invite Minister of Health and Welfare of Korea to the stage again. Please welcome her with a big hand. Now, the minister is going to help us proceeding with the ceremony. First, presidential commendations. When I call your name, please come to the stage. First of all, Wongang University Hospital.
표창장.
Commendation. Your institution is hereby commended for your outstanding contribution to national and social development through enhancing the global standing of Korean healthcare. President of Korea, Lee Jae-myung. And we will take a commemorative photo as well. Please face the camera in front of you, and the minister, please stand in the middle. We will take a photo. Congratulations. Please wait. We will continue with the presidential commendations. Second recipient is Hanyang University International Hospital. Presidential commendation. Your institution is hereby commended for your outstanding contribution to national and social development through enhancing the global standing of Korean healthcare. President of Korea, this is the winner of presidential commendation. As mentioned before, we have 2 institutions that received the presidential commendations. Now we're going to take a photo with the minister standing in the middle. Please show us your smile and face the camera. Thank you very much. Please wait on the stage. Now we would like to invite the representative from Wongang University Hospital to the stage again. We're going to take a commemorative photo all together. Please stand on the stage according to the guidance of our staff. We would like to ask for your further efforts for the development of Korean healthcare industry. Please give them a big hand and smile, please. Thank you very much. Congratulations. And we will move on to the Prime Minister's commendations awarding ceremony. First of all, we have Bright Eyes Clinic as the first recipient of the Prime Minister's commendation. Commendation. Your institution is hereby commended for your outstanding contribution to national and social development through enhancing the global standing of Korean healthcare. Kim Min-seok, the Prime Minister of Korea, congratulations. They have made great contribution to enhancing global competitiveness of Korean healthcare industry. We will take a photo. The Prime Minister's commendation has now been delivered, and we're going to take a group commemorative photo as well. Please face the camera. Congratulations. Please wait. The second recipient of Prime Minister's commendation, Wow Bose. Commendation. Your institution is hereby commended for your outstanding contribution to national and social development through enhancing the global standing of Korean healthcare. Kim Min-seok, the Prime Minister of Korea. They contributed to the globalization of K-medicine. Let us now take the photo. Wow, Bose, congratulations. please face the camera and smile, please. And please give them a big round of applause. Next, the third recipient of the Prime Minister's Commendation, Mr. Kim Sang-hoon, Planning and Management Director at Jeju Halla Hospital. Commendation. You are commended for your outstanding contribution to national and social development through enhancing the global standing of Korean healthcare. Kim Min-seok, the Prime Minister of Korea. Congratulations. He is the third recipient of the Prime Minister's Commendation. We will take a photo now. Please open the commendation, and the other recipients of the commendations may come forward for group photo soon. Now, we will invite all the recipients of Prime Minister's commendations and take a commemorative photo. Please open the commendations. In the global market, K-medicine is going to grow further and spread its influence, all thanks to these individuals and institutions. Thank you very much. Now you may go back to your seat.
나눠지는
Now we'll proceed with presentation of Minister of Health and Welfare's commendation. Awardees were presented to categories, organization, individuals. We ask the awardees please come to the stage as their names are called. We have the Yanjan Plastic Surgery Clinic in the category of organizations. Please come to the stage. In recognition of your outstanding contribution to promoting the excellence of Korean healthcare worldwide through the attraction of international patients and global expansion of Korean medical services, and for a significant role in advancing healthcare industry, this commendation is hereby awarded. March 19th, 2026, Chung Eun-kyung, Minister of Health and Welfare, Republic of Korea. Minister has given encouraging remarks, and we'll have a photo session later on. We also have Catholic University of Korea, Bucheon St. Mary's Hospital. Please come forward. Commendation, Catholic University of Korean Bucheon St. Mary's Hospital. The remainder is the same as above. Thank you and congratulations. Please wait a bit and please receive the flowers. We have Dr. Lee Do-hoon, Yonsei Orthopedic Clinic. Congratulations. Commendation, Lee Do-hoon, Yonsei Orthopedic Clinic. The remainder is the same as above. Congratulations. Along with the flowers and commendation, please receive those. And we have Jesus Hospital Maintenance Foundation. Please come forward. Commendation, Jesus Hospital Maintenance Foundation. The remainder is the same as above. Congratulations. Big congratulations. Also, we have Kachun-kil Medical Foundation. Congratulations. Commendation, Gil Medical Foundation. The remainder is the same as above. Congratulations. Hanggang Hospital. Congratulations. Please come forward. Commendation, Hanggang Hospital. The remainder is the same as above. Congratulations. I'd like to express my big gratitude. Korean Surgical Skills Study Group. Commendation. Congratulations. Commendation, Korean Surgical Skills Study Research Institute. The remainder is the same as above. We'll have a group photo here. Representatives of institutions, please come to the front. Going beyond the borders, that will contribute to the further advancement of healthcare industry. Congratulations to all of you. A big applause to all the awardees, please. Congratulations. So, along with the minister, we'll also present individual recipients of the Ministry of Health and Welfare's commendation. We have Cheng Jung-hee, team leader of American CIS team of Korea Health Industry Development Institute. Commendation, Choi Jung-hee, head of America's CIS team at Korea Health Industry Development Institute, in recognition of outstanding contribution to promoting excellence of Korean healthcare worldwide through the attraction of international patients and global expansion of Korean medical services for your significant role in advancing the healthcare industry. This commendation is hereby awarded to you. March 19, 2026, Chung Eun-kyung, Minister of Health and Welfare. We'll have a group photo later on. We have Park Soo-sung, Director of Planning and Coordination Office, ASEM Medical Center. Please come up to the stage. Commendation, Park Soo-sung, Director of Planning and Coordination Office, ASEM Medical Center. The remainder is the same as above. Congratulations. Park Sung-jun, head of the International Medical Infrastructure Support Team, Korea Health Industry Development Institute. Please come forward. Commendation, Park Sung-jun, head of International Healthcare Infrastructure Support Team, Korea Health Industry Development Institute. The remainder is the same as above. Congratulations. Please wait for a moment. We have Moon Sang-han, head of the International Team, International Clinic, Yonsei University Severance Hospital. Please come up. Commendation, Moon Sang-hwan, head of International Team, International Healthcare Center, Severance Hospital, Yonsei University. The remainder the same as above. Congratulations. I hope that your efforts also could further flourish. Also have Jo Eun-kyung, nurse of the Seoul National University Hospital, Gangnam Branch. Commendation. The content is same as above. Congratulations. Congratulations once again. We have Lee Mi-hoon, manager of Medical Career Support Center. The award will be given. Lee Mi-hoon, manager of Medical Career Support Center. The content is the same as above. Congratulations. So we have another awardee. We have Lee Young-cho, director of VIP Plastic Surgery Clinic. We have Lee Myung-ju, director of VIP Plastic Surgery Clinic. The content is the same as above. Congratulations. Congratulations. We have Shin Hyun-jin, deputy director of the International Business Division at Kim Byung-jun Radis Thoracic Surgery Clinic. Commendation. Award recipient Shin Hyun-jin, Kim Byung-jun Radis Thoracic Surgery Clinic. Same as above. Congratulations. We have Jung-ah, professor of Virginia Integrated Medical School. Commendation, Jung-ah, professor of Virginia Integrated Medical School. Remainder is the same as above. Congratulations. We have the last awardee, Song Young-il, International Corporation Physician, Korea International Corporation Agency. Commendation, Song Young-il, International Corporation Physician, Korea International Corporation Agency. The remainder is same as above. Congratulations. If the last person, all the individual awardees, please come up to the stage. Please stand here. So please show us your awards. And please hold the flowers on your right hand. For advancement of Korean healthcare, you have made huge contributions. You have gotten the honor of being the individual awardees. Please give them a big round of applause. Congratulations. Please make a very big smile. Thank you. Honorable Minister, please wait here, and we'll have awardees here. Thank you so much here, and we'll have distinguished guests here.
Those who are seated in the front rows are kindly requested to come forward.
Invite the guests seated in the very first row to please come forward first. 자, 먼저 앞줄에 계신 내빈분들 먼저.
We're going to invite the distinguished guests seated in the front rows to the stage, and those seated in the second row, please form a line behind them.
Row to please take their position along the back row on the stage. Please come up to the stage. 네, 이제 개막.
This is the last part of the opening ceremony. we invited distinguished guests and VIPs to the stage for commemorative photo with gratitude for being here with us despite their busy schedule.
자, 앞쪽 카메라
Please face the camera in front of you.
네, 위에 계시는 분
Thank you for your cooperation. Please stand closer to each other.
Sure. And ladies and gentlemen, we'd like to have a fighting pose. Cheer a pose with your right hand. After this one, 자 활짝 웃어주시고 이번에는 화이팅 한번 하겠습니다. 오른
With your right fist up.
고맙습니다.
Thank you very much for your cooperation. Now you may return to your seats. Thank you very much. Many distinguished guests have come here with full support for this event. With this, we would like to give thanks to all participants and distinguished guests. We are now going to begin the keynote address without a break. Please stay seated.
This brings us to the end of the opening ceremony of the Medical Korea 2026. But we will proceed with the keynote speech session without having a break. So ladies and gentlemen, please remain seated that we can welcome our speakers to the stage momentarily. And once again, please use receivers. Channel 2 will be in English as well. And ladies and gentlemen, we ask for your active participation and interest at this session as well. Please remain seated. 자, 여러분 저희는 이어서 기조 강연
We prepared keynote address, and during the keynote address, we provide you with simultaneous translation. Channel number 1 is for Korean. Let us invite the speaker to the stage.
수 있는 통찰력
The speaker will tell us about the insights in the medical industry. So we'll invite the speaker after a few minutes. Once again, after the opening ceremony, we'll have a keynote speech session. For those of people, please make some seating arrangements. Once again, I'd like to make a housekeeping announcement. Medical Korea 2026, after this opening ceremony, we have a keynote speech session. Please be seated.
keynote speeches of the Medical Korea 2026. Please take your seats, and if you can, please remain seated. Then we'd like to welcome our speakers momentarily to the stage. Thank you.
For those of you who are seated, please remain seated. For those of you who are standing, please be seated. We have AI-powered global healthcare, bringing the future closer and the world closer as well. So we have experts here to deliver keynote speeches. We have 2 speakers in the session. For those of you who are to join us, please be seated. Now, I believe everybody is seated. Now, it's time for me to invite the keynote speaker.
26, as I announced earlier, we'd like to now welcome our honorable speakers at this keynote speech session. So once again, please use your receivers. Channel 2 is in English, and our first speaker will be delivering his presentation in English. Please note this as well. 자, 여러분, 저희 2분의 기조 연설자를 모셨는데, 자,
We have 2 speakers. The first speaker will speak in English. For those who need interpretation service, channel 1 is for Korean. Please set your channel at number 1. And now let us start the keynote speech session. Medical Korea 2026 It's a great honor for me to introduce to you this unitary. The global healthcare world is flat. How new technologies impact global health. We have the speaker, who is the leader, the CEO of Marks Advisory, CEO of Marks Advisory. We have Mr. Edward Marks.
여러분 큰 박수로 환영해 주시기 바랍니다. Let us welcome him with a big round of applause.
Super excited and honored to be with you. I have nothing but deep respect. I think my entire country, the United States, feels the same way for Korea and all that you do, not only in medicine, but in other areas as well. When it comes to healthcare, we often look at you for guidance, for partnership, whether it's Samsung Medical Center or Seoul University Medical Center or some of the other healthcare organizations in Korea. We are inspired by all that you do. So I'm here to share with you a little bit about how the healthcare world is flat. And I will share with you some examples on how things have changed dramatically. Many of those things you're aware of. A couple may be new. But ultimately, I want to share with you the one single most important ingredient which all of us can control to make sure that we're able to leverage AI to truly help patients around the world. For those who don't know who I am, this is a little bit about my background. I have served at many great organizations that are global in nature and also participate as a member of Team USA for triathlon. I've been very lucky and fortunate to travel and climb many mountains, including I climbed the highest peak around Seoul recently, so you see a little picture there. And I'm also fortunate to have authored several books, and the last couple around AI, one of them with my wife, who's a clinician, about the AI-empowered patient, and I'll speak a little bit about that. But most importantly is family. So none of this can happen without a great family, and this is our photo from the recent holidays. And so I'm always sure to say thank you to family, because without our families and our support system, nothing that we do can really be accomplished or matter greatly. So I want to share with you the beginning of my story, which is actually 30 years ago, and it's the birth of our first daughter. We have 5 kids, and our first daughter was born, and even though AI was around in its infancy, it wasn't the way it is today. But I want to share with you something about what AI can do today and accelerate a great clinical and quality experience than it could have 30 years prior. And so our daughter was born without life. She spent 6 minutes without any oxygen or heartbeat as we tried to get her out of her mother. And so when she was born, they had to resuscitate her. And they weren't sure what to do because they felt she would die. And the only alternative we might have had at that time was to take her far away in a helicopter to get better care at a university medical center. But the problem was my wife was also severely injured, and separating the two would be very difficult. So even 30 years ago, we leveraged technology to enable clinicians that were many, many hundreds of miles away to take care of our patient, our daughter, remotely. And as a result, her life was saved. And it was at that moment I realized the power of technology to save lives. And that's been my mission ever since, whether it's at the Cleveland Clinic or writing for Mayo Clinic or an executive for New York City hospitals, whatever it's been, my mission is clear. And that is we will leverage technology and AI to enable more saved lives across the world. And other than her brief goth stage at age 14, she turned out pretty normal. So this was her when she was 18 back at the NICU. And today she's graduated from university and she works in healthcare to help save lives as well. But I knew the power, and that's the power of AI, that we all have the ability to leverage appropriately to save more lives. And that's my why. Because we can have great clinical care, and one of these pictures here is of Cleveland Clinic, and I had the opportunity to be in many great surgeries where we would take babies that were still inside their mothers. We would take them out, operate on them, and put them back inside and have miraculous outcomes. But everyone should have this capability. Everyone, no matter where they are, no matter their economic status or their geography, should have this same opportunity. We were climbing in the Andes not too long ago, and at 15,000 feet or 5,000 meters, we ran into a nurse that would walk around, and in her bag, she had remote monitoring capabilities. So she was taking care of some of the very few people who live at 5,000 meters in the mountains of Peru. And then a medical center that we founded many years ago in Tanzania in Africa, where at the time we didn't have technology to help our patients. But we brought people there. We were able to bring clinicians there to this open arms clinic. But now today, through AI and other technologies, we're able to give them similar class care as they would receive in Korea or as they would receive in the United States. And again, that's sort of why we're all excited. That's why we're all here to learn more from one another. What more can we do? How can we work together to bring these sort of life-saving capabilities and technologies all around the world beyond our borders? Because technology without execution is a broken promise. Technology without execution is a broken promise. We have great technologies, but oftentimes what is missing is not more computer chips, not more cloud capabilities, not more speed, but what's missing is courageous leadership. And I was so elated today to see all these great leaders come across the stage and all the great leaders that are in this room with us doing great things with AI. And that's what's needed more and more around the world. And I'm glad we're talking about it here in Korea because so many look up to Korea for what you do, for all the medical innovations we already spoke about, for all the abilities with leveraging technology to save more lives. So we're undergoing the biggest shift in the last 100 years. Healthcare has been slow, I think, compared to other industries. We haven't adopted as quickly technology as we see in finance, as we see in automation, as we see in banking. But I think we have the opportunity now to lead the rest of the industries with AI because we understand, because this is so important. These are capabilities that impact our loved ones, our families, our communities, our cities, our regions, our countries, and the world. And so these are the three forces that we see happening, right? Artificial intelligence, which is what we're talking about, but this concept of global connectivity, global community, that's what I loved, again, hearing this morning and meeting other leaders from other countries who were all working together to take care of all the people in the world. Not so concerned about just what's within our borders, but trying to help all of mankind. And of course, we have the digital health platforms that enable that. A lot of great exhibitors here in this conference that provide such capabilities which are necessary. And when you combine these three forces together, we're seeing this shift happen like it never happened before. We're moving from hospital to home. When I was at Cleveland Clinic, we were shifting 25% of the days that a patient would spend in the hospital to the home. The goal is really 75%. For most of us, 75% of the individuals, our patients that are inside hospitals today, thanks to AI and other technologies, can go home. We should send them home. Why? It's a better experience at home. 2, it lowers our costs. And 3, it frees up capacity in our medical centers to take care of those who truly need to be hospitalized. So we're seeing this happen, this shift happen today, where more and more people can be seen at home. We have great remote monitoring capabilities, as we're all aware of, that we're using today that is really making a difference in the lives of patients. I recently had a family member who came down with a heart condition, and in the past, they would have hospitalized her, taking a lot of time, very inconvenient, wasting a lot of money. But instead, they were able to give her a monitor, and she's fine, and she's fully capable. And that's really the way that we should have it for everyone. But it's not even for everyone. Not everyone has these capabilities yet. The capabilities exist, the technology exists, but sometimes ourselves, our structures, our systems can get in the way and keep us from truly allowing for the potential of all of this innovation. And of course, AI-powered diagnostics and virtual consultations. I may jump ahead a little bit. Let's see, maybe it's on my next slide, but it's really about becoming patient-centered from systems to individuals. Because our patients now have most of our patients, it's not even yet around the world, but many of us have as much knowledge and capability as our primary care clinicians, thanks to AI. And we're seeing a shift. And in many countries, including the United States, it is hard. It takes weeks, sometimes months, to see a clinician. Everyone is so busy. But many of the tasks that clinicians do today can be done with AI. We believe that, according to some studies and some models, that 85% of the care given today with primary care can be done via AI. I can give you so many examples because I try to live this way myself. I don't have time to go see my primary care physician, right? I'm like you. I'm very busy with my family. I'm very busy with my career, and I don't have time to wait. And then it takes weeks to get an appointment, and when you get that, you have to drive there, there's transportation, you have to wait there. And while I have great respect and honor for those clinicians, I just don't have the time, and many people are in the same way. And so we take the place of those who might truly need the care. So AI can do about 85% of what clinicians do for us today. We're talking about primary care physicians. There will always be a need, of course, for specialists to take care of the very sick and complex patients, but many of the things that we see clinicians for today, it's unnecessary to do it the same way that we've done historically. Times have changed. And that's why we can make this dramatic shift, and we can free up time and the minds and the skill and the experience of our great clinicians to take care of the truly sick. And we can release burden from our clinicians, the burden of doing a lot of manual tasks that should be automated. And what we say is moving from chores to core. Take away the mundane things that are not fun for clinicians and allow them to truly focus on care. We use the term pajama time, and we live with this at my home. My wife is a clinician, and oftentimes she comes home and spends time updating her medical records, right? That's not a good experience for the home. It's not a good experience for the clinician, and there's no reason in today's environment with AI and ambient listening as an example that we need to do that. So there's so much potential that we have, and those of us in this room as leaders can make this happen. So we're seeing this great shift of medical knowledge. Many of the patients that come into my wife's practice, they already are empowered. They already know a lot about their treatment and what needs to be done. And it's great because we always long for patients to be empowered. We want patients to be engaged in their healthcare. We know that when patients are engaged with their healthcare, that their outcomes are better, that they're more compliant to taking their medications. They're more compliant to doing the things, the treatments, the therapies that we require of them. So it's so important and it's so great. Now, of course, we know some of the trials that there is with medical knowledge. Is it proper medical knowledge? Is it trusted? And I think we will work through all those things, much like we did in the transportation industry with automated vehicles. We didn't trust the automated vehicles. We would look at the statistics of accidents with automated vehicles, and they were higher than those with drivers. But today, the studies have shown that those systems have gotten smarter, and the automated drivers are more safe than actual drivers. We're seeing the same thing in healthcare. So it's not a reason to not move forward, but it's a reason to move forward with caution and also some excitement. It's the same with diagnostic tools. I'll give you one example, but I give you a personal example only to make it real for you and I and to connect. But you can, I'm sure you've heard your own stories. It may be your own story or other stories. This is happening around the world. So I recently had some markers through a blood test, through labs, that showed I could be headed for some cancer. And my clinician, and I would go to my primary care clinician, she wasn't too concerned about it. But I started doing my own research with AI. I was a little bit concerned about it, right? Because I've had cancer before. And I followed best practices at a major university. And I ended up with very significant cancer, which I'm healed from, but I could have avoided it had we followed some AI capabilities. So this time, this was in February of last year, I asked for another test. So I did routine blood work, and then I took all my blood work, all my lab work, and I put it into AI. My clinician, she wasn't concerned. When she did become concerned, by the time I could get an appointment with a specialist was 6 months. So here I am with a potential cancer diagnosis, having to wait 6 months to see a specialist. So I just took all my lab data, I put it into AI, and AI analyzed it and said, no, there's a serious problem here. And yes, you should get an appointment, but at the same time, take a look at your diet. Take a look at what you're taking. And so I put that information into AI, and it said, hey, I think I found the problem. And it had to do with a supplement, something you would just buy at the grocery store. And I removed that supplement from my diet, retook my lab test, and it was all back to normal. Now, had I waited 6 months, I don't know what would have happened during that time if my liver condition would have gotten worse, which I suspect it would have. So that's just one example how the AI-empowered patient with all this medical knowledge available to us, all these diagnostic tools, is making a difference. Now imagine if all of us as leaders in our respective healthcare organizations and our governments made these tools available to everyone. And I'll talk about that. I think we need to make these tools available to everyone because it goes back to the trust. I know, again, some people might be a little defensive, like, can we trust these systems? What if they get the wrong information? And I think those are valid concerns. But if we, as trusted organizations providing care to our communities, to our citizens, provide curated assets like these diagnostic tools, it'll make a difference in the healthcare of our population, but also the world, because we can extend these to the world. So there's great health data, and again, great critical or digital care platforms. So we're breaking these traditional barriers because we were dependent, as we all know, on geography, income, infrastructure, but today that's no longer there. So we have these new platforms that we've all talked about, and some of the earlier speakers also spoke about this. You know, the capabilities of virtual care and telemedicine, the AI-driven triage that I just gave you a great example of, and the digital health ecosystems. So it's a great time to be in this industry, and we're reducing friction in healthcare delivery, right? The administrative overhead. I gave you the example of ambient AI, of the ability just to speak and have a lot of the manual work done for you. As I mentioned, my wife is getting that in some of her platforms now, so that the reduction of this pajama time. But it's very administrative heavy, healthcare is. And we can leverage a lot of AI to reduce that burden. And I know it's different in every country. In the United States, it's particularly burdensome with how we bill for or charge for healthcare, how we get paid for healthcare. And so there's a lot of automation that's taking place. There's a lot of agentic AI being used. But the best thing I love is the diagnostic capabilities. And we're also seeing the decision support capabilities. So in the past, we would rely on a clinician to have to take in so many data sources and try to figure out what was wrong with us. And they had limited amount of time. But now we're automating these things. We all know the examples from radiology. We all know the examples from lab. It's tremendous what AI has done to reduce a lot of the burden and really just allow our clinicians to focus on top of their license, to focus on the things that matter most instead of being overwhelmed with a bunch of data that can easily be filtered through, analyzed through AI. So we're seeing great strides taking place. But again, it's up to all of us to make this data, to make these capabilities accessible to everyone around the world. But these are great tools existing today, and why I said earlier that it's great to have these tools, and I love the tools and I benefit from the tools, but ultimately it requires you and I to help with the execution to make these happen. We're also seeing in discovery, in drug research, tremendous time compression. It used to take 18 years when a drug was discovered before a drug was administered to a patient, just because of manual processes and bureaucracy. And now we're seeing those times shrunk by many, many years to less than a year in many cases. And in some cases, they're in weeks. We're able to analyze new drug therapies, and we're able to put them through models, through AI, and predictive capabilities that enable us to bring new surgeries, that enable us to bring new medicines to our patients in an incredible rapid amount of time, saving a lot of time. So it's just amazing what we can do. But again, all of this requires leadership, and all of it requires focus. But overall, it improves the quality of health. So the healthcare world is becoming flat. Again, the title of my presentation. The healthcare world is becoming flat. It's already flattened in many different ways. And just to sort of highlight is the global access, right? The fact that we even have this interaction today over the next couple of days, not just within Korea, but there's many individuals here, such as myself, from outside of Korea. We exchange information daily. We partner all the time with my colleagues and peers at some of the medical centers here in Korea that I already mentioned. We have many, many different platforms that we all engage one another, and I think we need to continue to do that. One of the reasons behind many of the books that I've written are not books that I've personally written and spent all the time researching, but it's a collaborative effort amongst many different institutions across the world. And that's what's needed, more of this cross-collaboration and sharing of ideas, sharing of information, and this real-time knowledge sharing. So I'm going to share with you just a couple of examples, but there's really great speakers that are coming, following me the next couple of days, and they have really, really good examples. And so I didn't want to spend too much time on examples, but I want to share just a couple, just to remind us what we can do, all working together and providing the leadership related to AI. So one of the things, when I was at Cleveland Clinic, we decided that 50% of our outpatient visits would all be virtual. So again, instead of a patient having to drive someplace and sit down in a waiting room and wait to see a clinician for 2 or 3 minutes and then leaving, we would do it all virtual, 50%. 25% of our inpatient days, I mentioned, would be at home, and that could go up to 85%. But also to start doing transcontinental surgeries. So in the past, if we had a dignitary that required a mitral valve heart replacement surgery, we would have to send a team of clinicians somewhere across the globe. Imagine the cost, imagine the productivity lost for those clinicians to do all that travel when they could be taking care of other patients. And so now you're seeing that today. And I'm sure it's happening here in Korea as well. And it's certainly happening in the United States, where we're doing these intercontinental surgeries. So the sickest people anywhere in the world can have access to the highest quality of care. We're seeing drones being used to share medicine. Just this week, Satya Nadella, the CEO of Microsoft, announced the latest that they're doing in terms of pathology and sharing all this information around the world, leveraging AI to really democratize healthcare, to bring healing to everyone, regardless of geography, regardless of income. This is what it's all about. This is what we all can do. So how do we do it? Coordination amongst governments, we've already heard that today. You already saw examples of that. So what does that mean to us personally? This gets to the leadership here, and this is how I want to end. It's continuous learning and curiosity. We need to continuously learn ourselves. Too often, the decision makers aren't necessarily leveraging AI personally. And that's what I always challenge myself to do. I always ask my kids. If you have kids, they're great for this. We have 5 kids, I mentioned, and it's always like they're challenging my wife and I. What are you doing with AI? Why are you doing that manually? You could be using AI. So if we don't understand it, if we're not using it ourselves, then how can we lead others to use it? So we have to take it very personally. Create omni-channel experiences. So if you're a leader in a healthcare organization, a hospital, a medical center, or even on the supplier side, you need to create these experiences. As I mentioned, yes, some people will always want to come in. I have a 91-year-old father. He loves to go and visit at the medical center. We'll always have that personalization. We'll always have telemedicine and virtual capabilities. But now we need to offer the third omnichannel, and that's AI. I don't need to see a primary care. I mentioned that already. I could do everything, 85% of what I need with my physician via AI. There's no reason for any of us to have to travel to get primary care unless it's very significant. 85% can be done via AI, freeing up time. We have to reward entrepreneurship. So again, no matter where we lead, we need to make sure that we offer people the opportunity to try new things, fund them to do some great new things, allow them to take risk, remove barriers. Don't get so caught up in governance. That's what stifles us in the United States. We have so many rules and regulations, which again, I know there's a balance. You have to have some to make sure we don't do anything that could be harmful. But at the same time, we over-regulate, and as a result, we keep progress from happening. So that's our job as leaders. We got great AI, we got great digital platforms. The world is flat, we all know it, we all agree, we all shake hands, but we have to execute on that promise. So I'm gonna end with this story, and again, on how AI can save people's lives. So I'm a member of Team USA Triathlon. I mentioned that every year we have to qualify, top 10 make the team, and the top 3 go to the Olympics. And in the middle of a race, I felt my heart get heavy, and I ended up having an LAD, or an MI, or what's known as a widowmaker, a heart attack in the last 2 miles of the race. I didn't really know what was going on, and I thought about all different things, but I think I might be having a heart attack, which I didn't think would be possible because according to the Cleveland Clinic and all the tests I took, I was in perfect shape. How could I be having a heart attack if I'm a member of Team USA? But that's indeed what was happening. And so as you can see, I recovered. I had great care by a doctor, my wife. I had great care. I made it. I made the team. I was top 10. And the clinician said, well, you'll never run again. You'll never race again. But using AI, using all the capabilities, all the cloud, I won't go into details for sake of the time, but using the cloud, using AI, using telemedicine, using remote monitoring, 90 days later to that day, because I made the team, I was crossing the finish line at the World Championships in Denmark. And I share that story only to show you the power of technology, the power of AI to save lives. It started with my daughter 30 years ago, but it's even me today, and it's you today. And that's why we have to lead by example. We have to lead others and be courageous, remove the barriers, and make AI happen for everyone around the world. And so with that, I leave it back to you, that it's up to you looking in the mirror. I look in the mirror every day. You look in the mirror every day. If we don't make it happen, who will make it happen? It's you and me. What an honor that we have to be able to be in such a position. Thank you for having me. It's been an honor.
Thank you, Dr. Marks. It was our honor to have your presentation. Thank you.
If there's anybody who'd like to ask a question, we'll take questions, just 1 or 2 from the audience. Anybody who'd like to ask a question?
Floor. So if you have any comments or requires or any idea you want to share with Dr. Marks, we are happy to have them. Maybe that was perfect presentation. No question from the floor. 완벽한 발표를 해주신 것 같습니다. 여러분 다시 한번 큰 박수 부탁드리겠습니다.
Up in our applause, please.
네, 고맙습니다. 이렇게 첫 번째.
So it was the first keynote speech. Such a precious presentation. Once again, I'd like to express my gratitude to Mr. Edward Marks. Now we are going to listen to the last and the second keynote speech in the opening ceremony. The title is Medical Korea, a trusted name imprinted globally. The speaker is the leader of global healthcare, and also just like Mr. Kim Young-tae said, we have the honorable speaker, Director General Chung Eun-young, Ministry of Health and Welfare. Please welcome the speaker with a big round of applause. Nice to meet you all today. I am Director General Chung Eun-young of the Ministry of Health and Welfare. Medical Korea is marking the 16th anniversary this year. It's a very honor for me to be a part of this event. There have been 16 Medical Korea conferences, and I took part in 10 occasions. And I will retire soon, maybe June. This is going to be my last participation. Each year, I have had some kind of burden, but also expectations for the event for Medical Korea conference. As a practitioner, when I was involved in preparation for the event, I have seen the players coming into the field, and I've been thinking about how to make it bigger in scale and make it more fruitful. A lot of thoughts have gone into it. When we had the first Medical Korea event, our Director General back then made a keynote speech, and he said that such and such new project will be underway in Korea, and we need to have such and such a vision down the road. That's what he said back then. And Medical Korea, I know, will persist forever, but because this is my last participation in the conference, also I actually know that the people who have worked in Kaidi have asked me to deliver a keynote speech. They made a request for me. Now I'm here to do the speech. We kind of started out of scratch many years ago, and I see some familiar faces. We were working together, and we have worked together 2000, and also we have worked a lot, private and public, and healthcare industry of Korea has advanced a lot to this level where we see lots of fruitful results. After my presentation is over, maybe my burden will be lighter from now on. Maybe the person who comes after me will be burdened with even more assignments and burdens. And now I'd like to talk about how we started off and where we are right now, Medical Korea, and to achieve what kind of efforts we poured in. And I'd like to talk about what more efforts to be carried out down the road. And maybe I will actually toss on to you even more tasks to be carried out. In my presentation, I'll talk about how Medical Korea has become a trusted name imprinted globally. We have foreign patients coming to Korea amounting to 1 million. We are counting the actual patients number, and maybe we'll reach 2 million threshold in the near future. So 2 million, that's being realized. And just like we've heard earlier, the ecosystem around healthcare and technology around it is changing rapidly. So we are now moving to the new normal millennium era, and what should we prepare for and how can we do it? And based on what we have done in the past, what kind of preparation should we push for? So that's going to be the gist of my presentation. Let me start. In my presentation, I'll talk about the current status of Medical Korea, success factors of it, and a new leap towards the new normal millennia era. The staff of Kaidi have made a wonderful presentation, but I've been very busy. I couldn't prepare in English. I'm sorry that I have to deliver in Korean. For those foreign participants, I ask for understanding that I delivered a speech in Korean. So this is the current state. It was 2009. Medical Service Act actually wasn't allowing for foreign patients, but with the revision of the law, it facilitated influx of international patients. So the influx came in from 2009, May of that year. At the Industrial Investment Committee, global healthcare was designated as one of the 17 emerging growth engine industries, and there was a talk on which central ministries to take care of the assignment or the initiative, and it was the Health and Welfare Ministry who got to be the guardian authority of it. And after that point, there have been interministerial cooperation. In 2011, there was initial appeal of government-sponsored patient from the UAE pursuant to intergovernmental agreements, and also we had assignment with Saudi. We had Vovas at Royal Hospital and Samsung Medical Center and St. Mary's Hospital all moving abroad to the Middle East. And when we had SNU Hospital, there were 100 physicians and surgeons. And the health minister of the Middle East, when he made advancement, actually was welcoming it, because it was not just consignment. We showed ourselves how the medical treatments are underway through our doctors. And SNU Hospital, from 2014 until now, it is in operation in full swing. In 2016, there was implementation, enforcement of Medical Overseas Expansion Act, and there was implementation of reporting system for international agencies, and also introduction of evaluation certification for medical institutions catering to international patients. In 2009 and 15, I was involved in all these tasks. And when it was low period in COVID, I also was in charge of the vaccine development as Director General. And thankfully, after COVID, because of the fast recovery, we're now reaching the era of 1 million international patients coming in, which is very meaningful. Maybe I did a good job. Yeah, it was a joke. In 2024, we had the era of 1 million international patients. Before COVID, it reached 500,000, and it dropped to 200,000. But then there was a fast recovery where travel restarted. Number of patients coming into Korea increased a lot. So now we have 1.6 million, or even more this year. That's what we are expecting at this point. We are making stats every March, getting the numbers from each cities and regions, which is reported to the Ministry of Health and Welfare. Maybe there will be announcement for the numbers of 2025. Accumulatively speaking, 1.17 million 2024. So we see 1 million each year. As I said earlier, in 2009, as I was making the International Medical Center in Kaidi, we actually were thinking when would ever reach the threshold of 1 million, because Singapore or Thailand, we were benchmarking. The number there was more than 1 million, and we had 60,000 in 2009. So we were thinking, how can we ever reach that level? But now here we are with that number as of 2024. Now we have opened up the era of 1.17 million and onwards. So we have had this period of infancy and development, internal enhancements, recession because of COVID, and now we are in the phase of advancement. So this phase of advancement is something to be scaled up, which requires us to work even harder. In 2022, as we had the comprehensive plan, the target was 500,000, but we made the target already, so the target revised to 1.6 million as of the current stats. We probably will overreach that target as of now. So since 2016, we've had the information on medical overseas expansion performance. So we do provide consultations for operations, secondment of personnel, and so forth. And 294 cases have been reported. We do the investigations for these. The retention rate is 126. So the retention rate is on the rise as well. So the retention rate is going up. In the past, medical institutions went abroad and they didn't make a good success. But these days, with the higher private capacities and greater business models and scale, we actually see a higher retention rate, meaning they keep on providing services abroad. I think President mentioned economic benefits and effects. through the institute, I would do analysis on economic ripple effects and synergy and how much expenses are made. So 7.5 trillion out of 1.17 million, you can see huge ripple effects in terms of production stimulation and employment generation. So this industry is thriving, having huge economic benefits, not only in medical field, but also in related fields. There is the synergetic growth in the related industries as well. In the medical field, if you look at the current status of it, it was a Ray outside camera hospital, and there wasn't much a smooth transition because we were designated tier 2. So we made a huge request to become tier 1 in a decade. Korea actually was the first of its kind to get the tier 1 status in the Middle East. We have lots of patients coming in from Middle East, and we have lots of hospitals from Korea there, so our prestige is going up so that we have now a tier 1 status. And regarding the healthcare professionals, we actually have contributed to easing the divide, the medical divide. That's why we've got the award. And also, we are recognized. 7 Korean medical institutions have been recognized among the world's top 100 excellent medical institutions. So, what made Medical Korea successful? What are some of the factors? I think number one I can talk about is world-class Korean healthcare technology that we have. I know this is something you know, but we are top tier in terms of the 6 prominent cancers and 5 major organ transplants. So some of the surgeries that the US cannot do, we do in Korea. And also you can see the survival rate having the world record and the survival rate as well. And also we are leading the digital transition where our efforts have been recognized, where 7 hospitals have been included to world best hospitals. So 16 institutes here included as well. And I know it's kind of a bit bragging, but then I think the government is fostering the infrastructure a lot.
시작을 하면서 추경을 받아서 사업을 시작을 했습니다. 그래서 등록제도도 도입을 해야 되고 그다음에
We began this research in 2019 and we received additional budget from the government. And we had a committee on national medical brand. We had to register the brand and we created the website and we began to hold the Medical Korea conference. And we opened the course on growing global healthcare professionals. And I participated in the educational course to nurture interpreters in the healthcare center. And I was so much emotional there. And we were able to nurture interpreters in 5 languages. And we also created the educational course for growing international medical coordinators. And after the legal amendment and after receiving additional budget from the government, we prepared these arrangements. Also, there were some disputes regarding the medical incidents, and in 2012, the law on medical dispute mediation was enacted, and we prepared measures for mediation for medical disputes. We also adopted a system for the medical overseas expansion reporting system. We also have evaluation and certification system, as well as a value-added tax refund system for foreign patients. We are implementing electronic visa system. We changed our brand slogan. Illegal brokers are being strictly monitored, and those who report such case will receive reward. So compared to the initial period, we prepared a lot of infrastructure. At an earlier phase, we had about 90 institutes registered, but now we have over 2,000 institutions registered. So our infrastructure has grown significantly, and this system is now being managed and operated by local municipalities. They report to us the track records of the system operation as well. And in terms of the capacity of local municipalities, we created Medical Street in Gangnam and Medical Street in Busan. Also, there is a medical clinic in the same building of Hala Hospital. There's a hotel which includes a clinic, and also there's a mobile center in Daegu. These are part of the projects to enhance the capacity of our local municipalities in the healthcare sector. At Seoul train station, you can see the information desk or information center that provides guidance to the patients visiting Korea. And we have over 60,000 personnel, including interpreters and coordinators in the healthcare sector. We are managing the quality of translation of the interpreters, medical interpreters as well. We also place jobs, and we conduct matchmaking between the job seekers and the companies as well. In terms of PR, we are promoting the national medical brand, and we have operated the system for about 10 years. The amount of VAT refund amounts to quite a significant amount of money, and we operated the system till 2025, and we will discuss the adoption of the system continuously. And we have operated applications that are tailored to the preference of consumers. We also applied fintech to enable more convenient payment services. Also, we are improving the system so that foreign patients visiting Korea can easily search for information about hospitals. And every year, we designate 6 to 7 diplomatic offices in Korea to promote the Medical Korea event to people abroad. In this way, we are establishing the network across the world. And not just the government, but the private sector is also important. So our success and the track records that have been achieved so far have been possible thanks to the cooperation and participation from private sector. Healthcare sector is centered around the regulation under the Ministry of Health and Welfare. So all projects began as G2G projects in the earlier days. So in the early days, we improved the institutions and established infrastructure driven by the government side. Now, however, we have more private companies participating in this ecosystem. And we have also enhanced the efficiency in promoting international healthcare in Korea. And in 2010, we established an institution under the Ministry of Health and Welfare for consultations with local municipalities and private sectors. And we have continuously conducted the activities to share with other countries the medical technologies we have. We remember that Korea was once the recipient of the medical aid before. So Ha Ji-won, a famous Korean actress, and Song Joong-ki, a famous Korean actor, participated in our healthcare sharing projects. And at medical institution level, such healthcare sharing projects are being conducted very actively. And we have example of successfully attracting patients from other countries, in this case from the countries in the Middle East, under the sponsorship of the government. As you can see in the photo, actually in 2009, I came to acknowledge that there's a system like government-sponsored patient system, and then we signed agreement with these countries for government-sponsored patients. We signed the agreement with UAE in 2011, Kuwait, Qatar, and Bahrain as well. When we receive these patients, the provider agreement is the kind of agreement we sign with medical institutes that can accept and treat these government-sponsored patients. Through the system, we have seen an increase in the number of foreign patients receiving treatment in Korea under the government sponsorship program. We are also transferring Korean medical technologies and know-how to foreign medical professionals. One example is Medical Korea Academy. And from 2012 to 2019, we carried out this project. Also, we have conducted from 2014 the Medical Korea Middle East Healthcare Professional Training for fellowship doctors and for dentists as well. About 100 medical professionals from the Middle East go through this training. For example, 3 years of training are provided to the dentist from these countries under agreement. They don't just observe the Korean doctors doing their practice, but they can also have hands-on practice and experience. The number of countries have increased that participate in this training. That includes Oman, Kuwait, and Bahrain as well. So we are very thankful for the Korean doctors Korean and foreign doctors participating in this program. We also offer online training program, Medical Korea Online Training. So medical professionals from abroad receive training through the online training first and then come to Korea physically to receive Middle East healthcare professional training. And these training records are recognized officially as the medical training and the educational courses they completed in their own country. A few days ago, K-pop Demon Hunters received an award at Oscar. So just like K-pop, K-culture, and K-beauty or K-entertainment, K-medicine has also expanded its global awareness. Last year, we conducted a survey on the awareness and perception of people in around 20 countries on the healthcare industry of Korea. So Korea was ranked the top 5 in terms of pharmaceuticals. Korea was ranked at the number 1 in terms of cosmetics. And in this year's survey, I guess Korea's ranking will become higher in this survey. So all these results show that Korea's status has been really heightened in the world when it comes to healthcare. Then as for what we have to do for the new normal in the millennial era, I would like to propose some ideas. So we have 2 million foreign patients receiving treatment here in Korea, and this paradigm has shifted quickly. It is centered around AI. I am using ChatGPT every day. At hospitals in Korea, you might also be using foundation model, LLM, and many other types of AI solutions. We are also running decision supporting AI programs. In this way, AI has really rapidly made its way to the healthcare sector. So the border is being meaningless when it comes to the AI transformation in the medical center, and the security has become more important. And when it comes to rare and intractable diseases, AI-enabled service is also being enhanced. As a national policy agenda, Korea aims to become a powerhouse in medical AI, pharmaceuticals, and bio health. And we aim to achieve 2 million foreign patients by 2030 and expand the export of biohealth products. And we have detailed tasks, including strengthened R&D in healthcare and further support for Medicare healthcare AI innovations. So by 2030, we aim to become the global leader advancing into the future. At the National Assembly, a bill has been presented to amend the laws related to non-face-to-face examination and diagnosis for foreign patients. And we are also redefining the systems for the registration of medical healthcare companies. And all these legal reforms reflect our surveys conducted before in the healthcare area, and we are trying to pass these laws by the first half of this year. And regarding the telemedicine, we are trying to establish K-telehealth hub in the ICU and in the emergency room. We are making efforts to achieve transformation centered around AI. And for national hospitals, we are establishing AI expressway. And in this project, a lot of AI technologies will be created and further developed, which will be, I think, distributed across the world in the future. And we are focusing on high value-added healthcare services, and we're also focusing on developing high value-added healthcare products. Actually, 80 to 90% of the healthcare services are concentrated to the metropolitan areas. So we are trying to increase the access to such good quality healthcare services in the rural areas as well in other provinces besides the metropolitan area. And in Korea, there are many Korean hospitals that acquire data from foreign hospitals and demonstrate their technologies and make their way to the global market. Now we are trying to establish K-digital healthcare model. These ideas will be specified, and in the end of this year, we will announce the third comprehensive plan for this development. We will reflect the changing environment in our efforts so that Korea will continue to take the lead in global digital healthcare. That will be done by my successor. And as mentioned before, for further development of Korean healthcare industry, we made these efforts, and I shared with you the achievements we made so far. Going forward, we will do our best to share our know-how and technology with other parts of the world. Let me thank all the officials of the Ministry of Health and Welfare and KIDI for being with me in this effort. And I often met Sunil Lee, and thank you. Also, I would like to thank the members and the CEO of OpenED, the PCO as well. Thank you very much.
그래서 항상
She has been so passionate on the field, showing very good leadership. And I felt emotional myself listening to her speech. She told us about medical policies and medical career conference. And this is her last participation. And please give her a big round of applause for her efforts so far. Very good job. Thank you so much. We do appreciate your journey. It's very emotional and very meaningful keynote speech. And this is end of the session. I'd like to make some housekeeping announcements. Please wait for a minute. And we have lots of people participating in Medical Korea, online, offline. We have lots of programs on the second floor. So please check those out. And we actually are preparing a special event for those attending in person. So please do not miss it. And enjoy your lunch. And we'll see each other again for session 1, Global Healthcare Megatrends Beyond Healthcare, driven by AI innovation in the first session. Enjoy your lunch, and we'll see each other after some hour. Thank you.
자, 저희 행사 도움 주신 진흥원 가족분들 이 자리에 계시면 잠시 무대 위로 올라와 주시면 고맙겠습니다. 저희 진흥원 가족분들 저희 기념사진 촬영 함께 하시죠.